Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. I have Ashesh Patel, CEO of Ashana Health. Welcome to the show.
Thanks, Michael. Happy to be here.
Glad you're here. All right, where are you broadcasting from?
We're in Robbinsville, New Jersey.
Great. All right, now first, what does it mean to gamify an industry?
Sure. So within an industry, there are components and activities which are repetitive. Think about existing applications or processes, training, which are repetitive and really lack user engagement. So how do you increase user engagement while maintaining productivity? One method is to incorporate gameplay mechanics into these everyday activities. So incorporating a competition amongst peers or point systems.
Got it. What is Ashana Health?
Ashana Health is a digital rehabilitation solutions provider for physical and occupational therapy. We provide hardware, our Dyna Wheel, and in conjunction with our cloud-based application, which allows patients to exercise while playing captivating games, and also provides all the biofeedback for providers to track patient activity and progress.
How does Ashana Health gamify physical therapy? That's an interesting concept.
Yeah, we work directly with occupational and physical therapists to understand key movements and exercises they would do with patients with traditional pieces of equipment, and we incorporate that into our games. So, go ahead.
No, I was just going to jump in there with you. Keep going. That's interesting. Give me an example of what, I mean, because it's one thing to say that, it's a whole other thing to actually go through the process of the mechanics of gamifying therapy.
Sure. And for example, someone with a wrist injury where they're squeezing a medicine ball, upwards of 30 to 40 times, we can take that same motion and incorporate that into our hardware, but now it's in response to shooting a target or accelerating in a racing game.
Got it. Why did you start the company?
A combination of understanding an industry need and personal experience. My grandfather suffered a stroke, and I saw firsthand what an extensive treatment plan looked like, the little motivation and the engagement. And that really speaks to the adherence rate overall. The rehabilitation adherence rate is about 16%. I personally was also suffering from a herniated disc, and after really 1 week of physical therapy, I was over it. So that, along with understanding from a patient perspective, there's really little engaging, innovative ways to do physical therapy, and also from a provider standpoint, there's lack of data. So there's not objectively way to track patient progress. So those two primarily contributed to Ashana Health starting.
Tell us about the device you're bringing to the market.
From a hardware perspective, the Dyna Wheel is our patented technology which assists with upper body injuries. And our cloud-based application is our host of library games and curated games based on the patient injury type.
Okay. So let's dive into that one, because that is going to give you specific people that you're helping with the device. Where are you focusing with this device now?
Right. From a patient perspective, we're targeting people with traumatic brain injuries, stroke, upper body physical injuries, so anything related to the wrist, elbow, shoulder. Pediatrics is a target audience. And pediatrics.
Okay. Tell me about the beta testing process. Are you where you are on that?
We're wrapping up our game development for our MVP, which is 5 to 6 games. And we're working with local providers in the Northeast, anywhere from 15 to 20. And we plan on launching our pilot in early November.
Okay. Is there a data visualization component involved in this?
For sure. For providers, this is one of the key benefits. They have access to the portal where they can really track patient activity and progress. All the games that the patients are playing, whether they're in facility or in home, our application analyzes and tracks the data and presents it in an efficient manner so providers can make the necessary adjustments to the treatment plan.
Okay. And other care practices for Ashana Health in developing new products, where are we on that?
Mm-hmm. We have a roadmap that we plan to start working on in 2019 on the lower body, sports medicine. Gamification can really be leveraged in many different industries. It's just getting this proof of concept out there and then learning and reiterating based on that.
Any upcoming events that you're going to be presenting the devices to people so they can start adopting it and giving you better market penetration?
Yes, we're part of the Northeastern Innovation Summit as part of a panel participant, and then we'll also be at the New Jersey Physical Therapist Fall Conference.
Got it. And listeners and our viewers, they can follow up off your website, I'm assuming, or is there any other information you want to give to them before we part?
Sure, they can visit our website, ashanahealth.com, or they can email info@ashanahealth.com for more information.
Ashesh, thanks for being a guest on our show today.
Thanks for having me.
My pleasure. You've been watching CEO Money with Michael Yorba. Don't forget, like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.